Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today in our election series, what the 2024 U.S. presidential election could mean for health policy, from drug pricing to pre-existing conditions to the successful expansion of Medicaid. Stephanie Desmon talks to Dr. Gerard Anderson, a healthcare expert at the Johns Hopkins Bloomberg School of Public Health, about where each campaign stands on the issues. Let's listen.
Gerard Anderson, thanks so much for joining me.
It's a pleasure to be back talking to you again.
So I want to talk about health policy and the upcoming election in the United States. In previous years, we have heard a lot about healthcare policy, and it has been sort of one of the most popular topics that the candidates talk about. And so I'm wondering why we're not hearing as much about it in 2024.
So you're correct. It is not the topic, whereas in the past it has been the topic. So, if we'd have gone back and we were talking about Obama and that election, we were talking about expanded coverage and the Affordable Care Act, and everybody was talking about the fact that we had so many uninsured Americans. It's not that we don't have uninsured Americans still, but we have fewer of them, and they are in certain categories which have gotten less attention. When we talk about Trump, it was about replacing and repealing Obamacare. And the whole discussion was that because that was new and many people were unhappy with it. And so he tried to do it, but never got around to figuring out the right repeal and replace strategy. When Biden came in, the focus was on drug prices and really for Medicare beneficiaries. And they really focused on that particular issue. And now there isn't an overarching major issue. I mean, there is discussion about abortion, there is discussion about guns, but the major things about healthcare have always been about eligibility, coverage, and payment. And as I said just a moment ago, we still have about 10% of the population that's uninsured, but very little discussion about how to expand coverage. We have the states that haven't expanded Medicaid. We have some undocumented people. We have people that are eligible that have not chosen to have coverage, but there's not a lot of categories of what many people call the deserving poor, the people that we really say we've got to do something about. In terms of services, there's still many services that are uncovered. Probably the biggest ones are long-term care and caregiving, but these are very expensive options, and they are often under the control of the states, so they're not primarily a federal responsibility. And in terms of prices, drug prices were addressed in the Inflation Reduction Act. We have now a $2,000 out-of-pocket cap. We have $35 per month insulin for Medicare beneficiaries. We have limits on the price increases that Medicare beneficiaries can expect. The biggest issue coming up is probably overpayment for Medicare Advantage, but that's a very powerful lobby, the managed care organizations, and that's going to be a challenge for us. So that's sort of where we are in sort of the medical care side. Is there's not one thing that either Trump or Harris say is the major issue that I want to focus on.
We have heard a lot about the drug pricing situation and the success that the Biden administration has had. And Vice President Harris has said that she will continue with the drug pricing negotiations. I'm curious if you could very briefly explain what that means for people.
Essentially, in the first series, they identified 10 drugs. These were the 10 best-selling drugs in the United States for the Medicare beneficiaries. And they negotiated the prices. Part of it was set by the legislation. This legislation mandated a certain level of discounts. And then off of that mandated level of discounts, the negotiation occurred. And what we believe happened is they got additional discounts when they made those negotiations. And it was sometimes they were relatively small, and sometimes the negotiations got fairly substantial reductions in the price. But it was only 10 drugs. Now, what you got to recognize that it's 10 drugs that represented 20% of Medicare drug spending. So it was a big number. Now it turns to 15 drugs for the next 2 years. And so it'll probably be another 20% for the next year and almost 20% for the following year. So after 3 years, we'll get up to 50% of the drug spending, which is quite a substantial amount. And so, the question is, do you want to go faster? And many people think we should go faster, but it's hard to negotiate drug prices. I'm on the Maryland Drug Affordability Board, so we're doing drug prices in the state of Maryland, and we're looking at 6 drugs right now. And I can tell you from our very local experience, it's really hard to try to figure out what is the right price. So I'm very sympathetic to them saying with 10 and then 15 and 15 are the appropriate numbers. They've also, limited out-of-pocket expenditures to $2,000 for everybody and done insulin prices. So there's more things that you could do, but there's no big, huge thing in drug pricing that's going to get everybody super excited. And you want to see how it plays out. I mean, with legislation, you try it, and sometimes there's very good intentions, and sometimes there's unexpected things that occur. And the pharmaceutical industry is arguing innovation will, in fact, decline as a result of this. We have been studying this at Johns Hopkins for the last year and a half, written a number of papers about it, and found virtually no impact on innovation. The investment banking community is continuing to invest in pharmaceutical startups. The drug companies, the big drug companies, are continuing to invest in R&D. So we're just not seeing any reductions in innovation, but it could occur. And so, it's important for us to monitor it, but it's also important for the Congress to make sure that, the legislation that they passed doesn't affect innovation.
So what would a Trump administration look like when it comes to drug pricing?
So it's unclear what it would do. The Republicans, not Trump, but the Republicans have said some kind of repeal and replace, much like they did for the Affordable Care Act, but we haven't seen any specific replace. So that's a problem. So Trump put out a proposal that never actually got enacted. And so the proposal was to negotiate prices in Medicare Part B, which are physician-administered drugs. So you go to the physician and you get an injection for these drugs. And what he proposed is we get the most favored nation status, which is we should pay the prices that other countries pay for these drugs. And that would reduce the prices for most of these Part B drugs by 50%, 100%, even 200%, depending on the drug. So it would be quite a savings, but he never got it actually through his regulatory process. He could have, but it just never happened. Now, the question would be whether or not he would try this again. I think it would be a wonderful idea personally. It would reduce prices to international standards, but it's vehemently opposed by the pharmaceutical industry, which is a major supporter of President Trump, of our former President Trump.
So let's talk briefly about the ACA, because it's still out there and it's still Sort of what's the status right now? And I understand there needs to be some legislation next year to address it. And what we've heard from our presidential candidates, Mr. Trump has, quote, concepts of a plan on how to change things. And Vice President Harris, is very supportive of all of the help that the ACA has done, especially for people with pre-existing conditions.
So the real question is, what do you do about the sickest individuals, those with pre-existing conditions? Because if they are in your pool, the price of your insurance will be higher. And so what many people want is an insurance pool with just the healthy people with a very low health insurance premium. And that's not something that the Affordable Care Act does. And so they put everybody in the same pool. So the healthy subsidize the sick, the poor are subsidized by the rich. So we have all these subsidies built into it. And what President Trump seems to say, and it's hard to really understand the tea leaves of this, but he seems to be saying he wants the healthy people to have another option, which is a lower cost option that they can benefit from, that the people with chronic conditions and severe illnesses will have trouble accessing. And you can do this in a number of ways. You can limit access to mental health services, because people with mental health services tend to be very expensive. You can make it hard to get access to cancer treatments and comprehensive cancer treatments in a health plan. So there's a number of ways that if you allowed these things to occur, you could get a health plan with just predominantly healthy people, but that would sort of undermine the whole concept of health insurance, which is we're all in it together and we all take care of each other.
And what have we heard from the vice president on this?
So she is essentially in favor of retaining the program and trying to get the few states that have not expanded Medicaid to expand Medicaid. So we're seeing that slowly occurring. North Carolina was the latest one to decide to expand Medicaid coverage, and there are a number of states that haven't. So my expectation is that she will provide even additional incentives, financial incentives for these states to opt into the Medicaid program. And I think that's the major thing that will happen. There will be probably some discussion about undocumented Americans, but I don't think we'll get too far with that. So I would expect we will see mostly allowing the status quo to play through with the Affordable Care Act.
Could a second Trump administration undo the Medicaid expansion?
It could. And the way, the states decided to do so because they get very strong financial incentives. The federal government pays 90% of the cost and the state only pays 10% of the cost. But if you decided to change that and were able to change it from 90% to the standard 60, 70%, it might cause some states to drop out and reduce the coverage. Now, that would be a very difficult thing. You're taking things away from people that already have it, but it's not impossible for them to do it. And we've seen a lot of discussion about work requirements for people to be on the program. So states could impose additional work requirements that you either have to be employed to get the benefit, have to be actively working to get the benefit, or going to a certain set of schools to get the benefit. So if they could impose work requirements on individuals, which would make it harder for many people to get coverage.
All right. And real quickly, because we're running out of time, I'm curious what our candidates say about sort of the future of Medicare. I know that sometimes there's talk of, changing the age requirements for Social Security. Is that kind of talk on the table for Medicare?
It does not appear to be on the discussion point. Both of them says that we want to retain Medicare as it is in terms of eligibility and coverage. So I don't expect that to occur. Where the big debate will be on Medicare Advantage. Medicare Advantage is now used by over half the Medicare beneficiaries. It's private sector plans, and Trump administration wants to make everybody into the private sector plans and take away what's called traditional Medicare, or to reduce the number of people in that option. So I expect to see changes that will enhance people's ability and willingness to engage in Medicare Advantage and make it more difficult to get into traditional Medicare. And there's a number of ways that the administration could do that if they chose.
So we have a pretty big contrast between the candidates. As we wrap up, if you could quickly summarize what each administration might look like.
So I think it depends on if you have chronic conditions and are sick. If you have chronic conditions and you are sick, the options that the Harris administration effectively give you will protect you from high costs, will protect you from losing your coverage and everything else. If you look at the Trump administration, if you're very healthy and you're not worried about how it affects your parents or your grandparents, you're just worried about yourself, it is probably that your premiums will be lower and you will get either better benefits like gym memberships or something like that.
Gerard Anderson, thanks so much for your insight.
Thank you for asking me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.